Good evening. If you had to go to a hospital emergency room during the holidays, chances are you had a very long wait for a doctor. City News has brought you many stories of overcrowding in hospitals during the past few years, and the latest numbers show it's getting worse, with more patients coming than ever before, waiting longer than ever before.
I couldn't believe it. I thought we were in a third world country. I was appalled at what was going on. It was overcrowded, a lot of patients. There was basically over 100 people in there. There were people standing, children from a few months old. There were seniors there crying.
Shellanne Wallace took her 18-year-old to Humber River Hospital the Friday evening before Christmas. Her daughter was born with a heart condition and had chest pains. She says they waited overnight almost 7 hours before she could see a doctor.
A lot of people were there questioning, why is this happening?
Were they angry?
They were angry, yes. Security was called a few times.
To deal with angry patients?
Yes. Everyone was asking the nurses questions, but what are they going to do? We were told they're understaffed. There are a lot of nurses and doctors that work there that are sick too. It's the holidays, and that's basically the explanation we were given. And we were also told that we should call our MP.
Really?
To complain about this.
A spokesperson for Humber River told City News they've had the highest volume of patients on record this holiday season. Numbers from the Ministry of Health and Long-Term Care show several other GTA hospitals also over capacity, including North York General, Scarborough Health Network, and Mississauga Trillium. Hospitals are under increasing pressure with more patients arriving for treatment and more staying longer than they should because they're waiting for long-term care beds, which have 30,000 people on the wait lists. According to Health Quality Ontario, a government-appointed task force, over the past year, patients waiting for alternate care make up the equivalent of 10 large hospitals' worth of space every day, while emergency room visits are up over 11% over the last 6 years. Across the province, people spend an average of 16 hours in ER before getting admitted. That's more than 2 hours longer than 3 years ago. Walk-in and urgent care clinics are often closed when ERs are at their peak. Of the 21 City News reviewed, none was open after 8 p.m., and many had limited weekend hours. Now, a short time ago, I received a statement from Humber River Hospital. They tell me over the holidays they saw a 25% increase in ER patients, and right now they are at 111% capacity. North York General tells me they have not seen an increase in wait times. Now, if you'd like to see a comparison of wait times, hospital by hospital, go to citynews.ca/extras. And don't forget, the flu season hasn't hit in full force yet, so the strain on hospitals is going to get even bigger. And overcrowding is an issue that's going to be a real challenge for Premier Doug Ford, who promised to end hallway medicine. It's not going to be an easy or quick fix.